So I wanted to mention something that if I had said it years and years ago, before most people have woken up to that there is evil in the world, most people would think is crazy, but probably not so much now. And it's in regards to my last video regarding the 15-year-old patient. And I said in that video he was 14. No, he's 15. So I went into that was my first nursing job, and it was all DCFS kids. I went into that job, I guess naive. I just assumed that everybody cared about kids because they're innocent. And yet what I saw at this place, more than even before all that happened, was I saw that the people in the highest of positions, they would give a good talk about caring, but really didn't. Really could care less about those kids, and really, I would say, had even already written them off. All the kids. They were just disposable. So the nursing profession, our great nursing profession, has always come up with all their papers and their books about what care looks like and empathy. Yeah, if you try to do care and empathy from a book where the very people that wrote the book really don't even themselves know that they don't know what care looks like, then you will fail patients, in psych anyway, as far as I'm concerned. Maybe even in other areas. But I'm somebody that does that would say the hell with the book. I'm not saying that totally the hell with the book. I'm just saying that if you're truly wanting to come from a place of empathy, it has to come from the heart, not a book. Obviously, there are limits. But when this hospital had to try to make the case afterwards, because they accused me of abusing a patient, and they never were able to make the case, obviously, because it was a lie. But they scrambled to try to make the case. Well, they started trying to go after the fact that I did care. And I did. I did a lot. I did a lot. Some would say, oh, I went too much above and beyond. No. I would bring in remedies for like every night at bedtime, these kids on the girls unit, boys unit, young adult, they would oftentimes cause riots. And I would sit back and think about, there has to be a reason for this, because most of these kids are not psych issues, they're behavioral. And so I figured, no, they come from all this line of trauma. So that's the quietest part of the day. They want to avoid that because of flashbacks and thinking of things they don't want to think about. So it's better to cause a ruckus or a riot even, literally a riot. So I came up with ideas, and I don't want to go into all the different things I did, but I brought improvements to the unit. So much so that the hospital implemented many of the things I did on my unit onto other units. But I think there's people in leadership positions that are put there on purpose, not at every place, but some places, especially when you're dealing with the state. And they're put there because they really don't care. And I think some of those people, they resent people that really do care. They resent them so much, they maybe personally take great joy in trying to go after them. Because in some ways, I feel like what happened with all of the people that failed to do the right thing, because I've reflected on this for so many years, from every angle, everything that happened. And really, what I would always come back to is it seems that the very people that didn't want to do the right thing weren't people that really seemed to care much to begin with. And yet, those people tend to hate the people that truly do care. And there's not really anybody that's worked with me that could say that I don't care. But my belief is that to truly be empathetic, it has to come from the heart, not a book. And so, especially with DCFS kids, they can tell a bullshitter. So they can tell the people that are just going by the book. And then they have no respect for you. But the people they know that are truly trying to help, that goes a long way. It goes a long way with every patient, actually. But we live on this planet. We're all human beings. we shouldn't need science to tell us what caring looks like. I think that's part of the problem. I think the way science tells you to care is it teaches people not to really care. And then that doesn't help patients. So a lot of the things that I had implemented on my unit, they made improvements. I mean, any psych nurse that can bring hope to a patient, that's a win. Even if it's temporary, it's a step forward. I mean, in my opinion, that's really what we should be doing. But, nursing would give you all these scientific reasons of, well, no, you're supposed to do it this way and that way. Yeah, and that's been done. And look at the revolving door that's happened in psych. So there was a lot of kids that I had helped. I didn't save them, but gave them hope, okay? And I think that people that had already written these kids off, that see them as disposable, don't care what happens to them. I don't think they like the people that really care. So this whole thing that happened was also an opportunity for those people that don't care to go after somebody that truly does, because they started bringing in the things I did. Well, many of the things I did, they implemented in the hospital. But the thing is with this particular kid, his therapist and I were trying to get him into this 30-day program because he had a vested interest in getting sober. He was 15 and he had a 2-year-old son that his girlfriend and her parents were raising. When he would get to go home, like to his mother's, which was rare, he would see his son then. And he did not want his son to see him in a prison the way that he saw his dad. So for that reason alone, he was invested in getting sober. And so while fighting with DCFS, because DCFS didn't want to send him to this 30-day program because treatment centers for addiction are open door. They're not locked units like a psych unit. And every DCFS kid has to be in a locked facility because they run otherwise, which is true. But that tells you how much the system sucks. But the therapist and I kept telling DCFS, no, you can trust this kid. This is important to him. And I had already started him working on the first 3 steps of Alcoholics Anonymous. Believe it or not, Alcoholics Anonymous isn't even an option for kids in the DCFS program. They can't go to AA. They have a drug program, a special drug program in DCFS. Guess what goes on in the drug program? It's a classroom where kids sell drugs. I mean, they do worksheets too, but really sell drugs. And I heard that from more than one kid. So finally, DCFS had allowed this kid to go to the 30-day program. He did beautifully. And this was all after everything happened with what they did to trying to manipulate him and everything. So it was a positive step. But then after the 30 days, the treatment center told DCFS he needs to go to a sober living home for a year. And that would have been the next step on the journey of his recovery, and that's what he wanted to do. DCFS said no. They put him back in the drug-infested, abusive group home that he came from. So when I say that they deliberately set these kids up to fail, they do. And many of those leadership people, whether nurses or chief people at the top, they just are not caring people. They just know how to say, this is what caring looks like, and you're doing it wrong. No, they just don't care, and that's part of what is wrong with our healthcare, in psych anyway. Not everywhere, but many places. So, that is a failure of the system. To not even, this kid they don't let these kids go to AA. They don't let them get a sponsor. They don't even have the books for Narcotics Anonymous or Alcoholics Anonymous. So I think there's people at the top, like at American Nurses Association, the people that want to tell you what care and empathy looks like. Yet those are the same people that went along with gender-affirming care on youth, showing they don't know what care looks like, because true care comes from the heart. And people that don't care, they hate people that care from the heart.